Insight and first episode Psychosis and its relationship with negative symptoms and remission. So research has suggested that improved insight is associated with greater medication compliance and improved outcomes for first episode psychosis. Previous studies have also shown that the level of insight is inversely correlated with psychotic symptoms. In this study, we propose to examine the relationship between insight, negative symptoms, and symptom remission. Our methods. So our sample population was a group of patients that were admitted to the PEP, or Prevention and Early Intervention Program for Psychosis at LHSC. They were recruited between March 2017 and February 2019, and they were assessed at medication initiation and at 3-month follow-up. With regards to sample size, 47 subjects were initially assessed, with 27 completing follow-up at 3 months. Ages range between 16 and 39, with approximately 77% being male and the majority being unmarried. This table shows the psychiatric diagnoses for our sample, with schizophrenia being by far the most common diagnosis. Measures that we used. Psychotic symptoms were assessed using the PANSS, or Positive and Negative Symptom Scale, as well as the BNSS, or Brief Negative Symptom Scale. We also separated out the motivation, pleasure, and expressivity subscales of the BNSS. Insight was measured using the SUMD, or the scale to assess unawareness of mental disorders. We used both a mean of the total score as well as the awareness subscale of the SUMD. 17 subjects achieved overall symptom remission at 3 months, 10 did not achieve remission, and 20 were lost to follow-up. The association between insight, remission at 3 months, and positive and negative symptoms were explored using Spearman's test or Mann-Whitney U test. Stepwise multiple linear regression was used to examine the factors predicting symptom remission. Our results. So there was no relationship between the SUMD and positive symptoms of the PANSS. The awareness subscore from the SUMD was associated with the BNSS motivation and pleasure subscale. However, there was no association found between the SUMD and the BNSS expressivity subscale. In terms of predicting remission, so remission was defined as a PANSS score of mild or less on all items. That includes both positive and negative symptoms. Better insight was associated with symptom remission at 3 months. A stepwise multiple linear regression was conducted to determine if insight and initial psychotic symptoms predicted remission at 3 months. So you can see in the table on the right of the screen the variables that were included in this model. These variables were selected as they've been found to be associated with symptom remission in previous studies. Marital status, completion of high school, and socioeconomic status were included as markers of premorbid function. Insight, expressivity, and gender were the variables that were retained within the stepwise model. This regression was found to be statistically significant. Insight was found to be the factor most significant in predicting symptom remission. Expressivity and gender were also significant predictors of remission at 3 months. Our conclusions. With regards to limitations, this was a very small sample size, and we did not examine the role of medications in remission. Insight has traditionally been assumed to be affected by the severity of positive symptoms. However, the findings from this study highlight the relationship between insight and avolition in psychosis. Both insight and negative symptoms were shown to predict short-term symptom remission. Female gender was also predicted short-term symptom remission. This is in keeping with previous studies, so showing female gender to be associated with improved outcomes in schizophrenia. The significance of insight and negative symptoms in predicting long-term recovery remains unknown and an area for further study. Thank you. These are my references.